about us.
Hello. What's going on, everybody? CT Lynn, Roel. What's up, everybody? We're getting on Instagram right now. I believe we're loading up. All right. If you're with me, let me know. Grandma Mary, I'll see you soon. All right. I think we are live in all the places. Beautiful. How's everybody doing today? How is everybody? Welcome to the Performance Medicine Show, Tuesday night, 7 to 8. I see you guys on Instagram. Mel, what's up? Stephen P, what's up? Goss, what's up? We're answering questions tonight for the next hour. If you guys have questions, let me know. Dr. Rogers is back in the building. Foxy Moxie, what's up? From New York State. Tom, what's going on, man? So good to see you. Yes, it was a perfect day. Getting a lift in the garage sounds incredible. I did not get outside enough today, but I did get to eat lunch outside, which was cool. Montana, what's up? Great to see you in here on Instagram. Hello, hello. If you guys have a question for Dr. Rogers, go ahead and put it in the comments. Edna, what's up? Hello, hello. Happy Tuesday to everybody. Happy Tuesday to all those who celebrate Tuesdays on Performance Medicine shows. All right, Dr. Rogers is on his way. Oh my gosh, Montana, I'm so jealous. It was beautiful. The weather today was about as good as it gets. Carolyn Maddox, what's up? Great to see you over there on Instagram. Zach, what's up, man? Great to see you over there on LinkedIn, to all the LinkedIn family. All right, we're gonna real quick, if you guys have not checked this out, do. Latest episode of the Common Sense MD is on staying healthy at 70 beyond, and this is not for just the 70-plus-year-olds. This is for all of us. Dr. Rogers talks about turning 70, things he's focusing on. I want to see, where is that? The three things he was mainly focused on in this episode was cognitive decline, orthopedic impairment, and what would the other one be? I'm going to have to look it up. That's going to bother me. Cognitive decline, orthopedic impairment, and we have an adjacent blog. That's why I'm looking at our website. Energy impairment, orthopedic problems. There we go. Those three. And speaking of cognitive decline, Robin Rill, the star of Explain This, and our nurse practitioner in the West Knoxville office, goes over the Bredesen protocol. And we talk a lot about the end of Alzheimer's, Dr. Dale Bredesen. We haven't gone in detail on the channel on the actual protocol. Robin does a fantastic job of making this easy for somebody like me to understand. So if any of you want to know more about the Bredesen protocol, I know my fiance, her grandmother, I believe, had Alzheimer's, and she's reading the end of Alzheimer's now. Those of you who've done the Cleveland, and maybe you have that APOE4 gene. A lot of preventative stuff in here with Robin, so definitely check that out. Encourage all you guys to check it out. Carnivore Craze, what's up? With you. Okay. Thank you for that question. Thank you for watching the fenbendazole video. Linda, what's going on? Mama Bear does have a birthday here soon. Should be here on Thursday, the 27th. Happy early birthday, Mama. See you there in the green room. Katie, what's up? It was great to see you over here in North Knoxville today. Got to eat lunch out on the back porch there. It was wonderful. Thank you for that. A little Firehouse subs. Shout out to Firehouse here in Knoxville. Don, what's up? Let's see. Thank you, Foxy Moxie. I love the comments here. If you have a question for Doc, go ahead and put them in the comments. We're going to get to every single one tonight. Let's see. JB from Tennessee. What's up? Lindsay Bo'Neill and Lindsay B. O'Neill. What's up? Great to see you guys on Instagram. Thank you guys for hanging out. Let's see what else. If you're a patient of ours, let's see, in one of our offices, we put this in our newsletter today, all the different aesthetic stuff you could do this winter. It's still February, still time to take care of your skin. These are all the different things we do at the different offices for aesthetics. Huge shout out to Kelly, Emily, Jasmine, all of our estheticians do such a great job. Let's see, and I'm going to put this up for Carter over there in JC. We're doing breast thermography on March 27th and March 28th. Make sure you sign up. There's only limited spots available. It's going to be happening 2 days in the Johnson City office only. If you guys have any questions about that or any of that, let me know in the comments. We'll get to the questions here. I see Doc's in the building. He's back from vacation, ready to roll. All right, let's get going. Let's see if I missed anything. No. All right. If you guys got a question for Doc, I see you, Tom. Thank you. Thank you. Yes. Anybody here on the newsletter who get Performance Weekly? Does anybody get that? If you don't, you should. Goes out Tuesdays at 3. A little bit of everything in performance medicine's world. All right, Doc, ready? What's up, man?
Hello, Ben. How are you?
It's so good to see you.
Same here. Same here.
I got to see you a little bit last week when you got back from vacation. How you feeling? You feeling refreshed?
I feel great. Had weather down there in the mid 80s. Came back here, 18 and snow. But it's great today. I just got off my bicycle riding outside. Had a great bike ride. So yeah, you did a good job. You and Andy did a great job while I was gone.
Oh, huge shout out to Andy. Andy did such a great job the last couple weeks answering y'all's questions. He'll be a regular on the show, answering all y'all's questions. He, his answers to, like, gosh, any and everything are just, they blow my mind every time. So thank you, Ange, for doing that. I know you're watching. What's up, Mark? I see you. Yeah. Mark saying you look a little younger. I agree.
I feel younger. Thank you.
All right, guys, we're gonna, whether you're out walking with the family, walking the dog, outside, cooking, whatever you're doing, we appreciate y'all being here. If you have a question for Doc, put in the comments. Let's start with a few that came in throughout the week. Thank you, Melanie. I'm gonna put this up. This will fire you up, Pop. Thank goodness for you.
Thank you, Melanie.
All right, let's start with this question. I missed this question last week, so we're going to put it first up on tonight's show. What causes gallbladder issues, and does diet contribute to this problem?
That's a really good question. Usually you're talking about gallstones that cause a lot of the problems. Your gallbladder stores bile made in your liver. Your gallbladder stores the bile. The purpose of bile is to help in digesting your food, especially fats. And for a lot of people, they form sludge and then maybe gallstones that can block the outlet to the gallbladder, where it squirts out and helps you digest your food. And these gallstones are really made of bile and cholesterol. So if they crystallize, and really nobody knows why one person will get gallstones or gallbladder dysfunction, sludge, where another one won't. There's certain risk factors, though. Being female, we used to call it the 3 F's: in medical school, and it's not fat, female, and 40. So, you know, overweight females in their 40s is typically what you think about. But heck, I mean, I've seen all ages. I think my father, who did a lot of gallbladder surgery, he told me he took a 2-year-old gallbladder out for gallstones. That was a hospital record at the time. So there's certain risk factors. Certainly, diabetics have more gallstones. People that eat a terrible diet of bad fats can form gallstones. You know, it's metabolic. It's part of metabolic syndrome, really. So if you're overweight, diabetic, insulin resistant, you're more likely to get gallstone and gallbladder dysfunction. So what do you do to prevent it? Stay lean. Don't eat too many fats at one time. Again, I like a high good fat diet, but what I don't like is the PUFAs, the polyunsaturated fatty acids. Those are the bad boys. It's not really the saturated fats in themselves. But I see some people that have really high cholesterol levels in their bloodstream that will have gallstones. One thing that can precipitate a gallbladder attack is losing weight rapidly, no matter how you lose it, whether it be through a GLP-1 or HCG, keto diet, just starvation diet. It can precipitate gallstones to start causing problems. So that's one thing I try to warn my patients about sometimes. If they have a history of gallbladder problems and they're getting on a major weight loss program, say like HCG or even the GLP-1s, it's not the drugs themselves that cause it. It's the rapid weight loss that can precipitate or cause this sludge, this cholesterol bile mixture to crystallize and I guess get dehydrated and form stones that can block the outlet and then cause severe pain, and you can end up having acute cholecystitis. But your gallbladder is just that storage organ for bile. You get these bile acid salts that help break down mostly fats. So it's kind of a metabolism problem. So that's a great question. Really good question.
Is it more common than I think? If based on what you're saying, like I feel like that could be pretty prevalent.
According to my brother and my dad, they took out a lot of gallstones. I'll tell you that much.
Yeah.
Yeah, it's pretty prevalent. Typically your gallbladder sits up under your right rib cage. So if you have a lot of pain after you eat a meal, especially a fatty meal, you need to get an ultrasound of your gallbladder to see if you have stones. And sometimes you can not even have stones on the ultrasound, but if you still have problems, we get something called a HIDA scan that will show the function of your gallbladder. So it's a great masquerader too. A lot of times gallbladder pain can not be typical. It can hurt in different places. But I see it way more common in women and way more common in people that are overweight. So great question.
Super interesting. Thank you for that question. Came in last week on the show. This one came in over on LinkedIn just today. Thank you in advance for this. Important topic here, the difference between unipolar and bipolar depression, and is the treatment the same? So this is around kind of in the mental health arena. I know, as you know, in primary care, this is something that you see a lot of. What's your thoughts on this real quick?
That's a really good question because it's very important. The treatment is not the same. The problem with, just being diagnosed by your primary care doctor with depression and automatically put you on an SSRI, which really don't help much anyway, not much more than placebo. But if they do that and they're really bipolar, then they can really become worse. Unipolar depression is just when they're depressed. Bipolar is depression with alternate manic episodes. It tends to be more episodic, more really variable. Has a lot of different features that unipolar or just major depression will have. Usually unipolar, which just means depression, is gradual, and you don't have these manic episodes that you see with bipolar. And for bipolar depression, a lot of it depends on whether you have more manic episodes or more depressive features, but there's a different class of medications that they use for those. So in my opinion, most of the primary care doctors should defer, unless they take a special interest and are really good at bipolar, they should defer that for psychiatric care. But medicines like the old one, lithium, but now there's a bunch of new ones like Seroquel and some of those. But so there's a major difference, and it's very important. You got to make that distinction, because if you put somebody with bipolar depression on an SSRI, it can increase their risk for mania, suicide, can really cause problems. So with mental health, which we see all the time in family practice and internal medicine, you really got to know your stuff and when to refer. Very important. That's a great question. Really good question. It seems like we're seeing more bipolar stuff than we used to. And bipolar disease tends to be in younger populations than unipolar does. So great question. I hope that helps.
And I'm assuming when you diagnose something like that, I still feel like it'd be hard to diagnose. There's no, you're just looking at behavior. Like some of it would be subjective, wouldn't
it? Very subjective. Yeah, like a lot of things are.
Yeah.
A lot of things in medicine are subjective. So with a typical doctor, they have about 7 minutes to spend with you, and they usually come in for something else, and you may happen to notice, hey, this person's really depressed, or this person's in a manic episode or a hypomanic episode where they feel great. Hypomania is usually the first sign of a bipolar illness. That's when they're just feeling great. They're getting stuff done and all. And then they get depressed, or they get hypermanic, which is, they'll stay up for 2 days in a row. They'll start spending money. They'll start gambling. They'll start doing, bizarre behaviors. So a lot of times the family needs to be in there with the patient, I think, and you definitely have to spend more time with these people. It's very important. It's life or death in a lot of cases.
Yeah.
You can't ignore it, and you need to know a good mental health professional. There's a big shortage of them right now. And a lot of times the primary care doc is the ones that ends up doing a lot of this psychiatric care. And then, a lot of times too, a lot of them may be reluctant to refer because it seems like these days psychiatrists are more medicine prescribers. They don't sit you on a couch and try to analyze you anymore. A lot of this stuff can require cognitive behavioral therapy, and it's time consuming. There's people out there that do it, but there's a huge shortage, and it takes a lot of time to do it. And the field of psychiatry is really short-handed. So it's very important that the primary care doctors need to be able to recognize it and even become familiar with it. And, if you don't have resources to refer to, you need to start being able to really dig deep and treat it yourself, along with other ancillary personnel.
Yeah.
Like, psychologists and their mental health therapists. It's a lot to it. It's not just a pill. Lifestyle.
Like with a lot of what we talk about on this show is, a lot of it comes down to
Certainly.
really taking control of your own health. And this one's a tough one. So
Yeah.
I really appreciate this
question, though.
question coming in. Yeah. Thank you so much. All right, real quick, Doc, before we're going to take live questions here in just a second, guys. So if you have a question for Dr. Rogers, I see, let's see here. I saw a couple there around gallbladder on Instagram. Thank you for that. Lisa, I see you. Go ahead and put it in the comments. We'll get to everyone tonight. I want to ask you real quick, because I think it'll bring a ton of value to the people with us live tonight. Tell us a little bit about the premise of this. If they haven't watched the episode, why did you pick those three? The orthopedic problems, the energy impairment, cognitive decline. Give us kind of your thought process behind this episode.
Does that mean the glasses? I never wear glasses.
You look so serious.
I did here to prove a point. I do have to wear glasses to read sometimes. I don't like to wear them. But
it was interesting. We doing a little post show talks, and you mentioned hearing and eyesight, getting those checked as well. Anything you want to add to this episode about staying healthy for yourself, like things that you're doing as you head into the 70s?
Oh, man, I'm doing everything. I do a lot of biohacking, as everybody knows. All kinds of stuff. All kinds of supplements, red light, infrared therapy, methylene blue. I mean, I do a lot of stuff physically and supplementally, and I focus on my sleep, and there's just a lot of ways you can biohack things. I take rapamycin, you look at my blog on rapamycin for sure. So I do a lot of things, but it's funny when you go to Florida for a few weeks and you look at older people, and
is that what brought on that episode?
Yeah, it is.
Yeah.
I just turned 70 and I started looking at everybody down there, mostly retired folks, and just interesting people. Had some great conversations with the couple that stayed next door to us. The gentleman was sharp, and he was 92 years old, and she was 87, I think. Just wonderful people from Boston, and they had both taught at Harvard. I mean, they were sharp. They'd done a lot of things. They live right near Heartbreak Hill on the Boston Marathon, but just a lot of good conversation. And I like to observe people, their postures, their bellies, the way they walk, just to evaluate it. And in any event, so I guess that got me thinking about it, and that's why I did the podcast on things you can do to kind of, help yourself, and things you need to start thinking about. And the first one was metabolic, which includes all the chronic diseases, and metabolism, energy. Metabolism produces energy, and most people get energy deficits when you get my age. And so I'll look at, that's one thing you have to look at, insulin resistance. The second was orthopedic impairments.
That one was interesting to me.
Which we all have, or most of us do.
Yeah.
And then I started thinking about that when my knees started hurting from too much walking. And then the third one was cognitive impairment decline. And like I said in my podcast, 2 out of 3 people age 70 or above have some cognitive impairment, whether it's short-term memory loss or other things. So you have to really start looking at that. But yeah, it's a good podcast, I thought.
Yeah, I really encourage everybody in here, no matter what your age is, to check that out. It's a short one, but chock full of things that I know Doc is doing right now.
Start early. Like hormone replacement therapy. Start early.
Yep.
Way better if you do.
Yep. All right, guys, if y'all have any questions around that, put in the comments. We're going to get to the live portion of the show. Thank you guys for hanging with us so far this evening. If you're new to the show, let me know. Let me know where you're at. Would love to get to know you a little bit better. Let's go to Carnivore Craze around fembendazole. Thank you for watching that video, Carnivore Craze. My dad was just diagnosed with acute leukemia last week. I'm sorry. I watched a video you guys made a while back about fenbendazole and cancer. Would that work for leukemia as well? What's your thoughts on this?
There's a lot of positive things about that. You think about mostly when you talk about that, talking about solid tumors, but blood cancer seemed to respond fairly well too. AML, acute myelogenous leukemia. Yes, certainly. Your dad needs to see a good oncologist. Chemotherapy works. I really like my favorite thing, and this is a good topic because I just spent 2 hours with an oncologist last week discussing cancer, and we had a great discussion. I'm going to get her on the podcast soon, and we're really going to break it down. She's really open, which most oncologists are really not, but she kind of feels, and the way she likes to practice medicine is with low dose chemotherapy along with other adjunctive therapies that you can use. Certainly she was all about ivermectin, fenbendazole, believe it or not, IV vitamin C, fine with all those. Don't ignore the chemo that can really put him into remission and hopefully turn into chronic CML, not AML. But that can come on pretty quick, so it needs to be treated aggressively by an oncologist. But also, see what the plan is, and think about some of the other stuff first. But see what the plan is first before you start thinking about too much of the other stuff. But certainly, I would definitely use Fenben and ivermectin. I'd get on a keto type diet. I would really do a lot of other supplements. But yeah, you have to hit it with all angles. And it's great news to me that she thought, this oncologist I talked to, that it's going to be way more accepted. There's a lot of doctors that are starting to think like we do, and it's going to be way more accepted in the future. All kinds of natural healing as well, things you can do. So good luck with your dad. Hopefully he can get on a regimen that will really turn it around.
For Carnivore Craze, which one would you do? Carnivore versus keto for his dad?
They're really very similar. I mean, a carnivore really is a keto diet, unless you're adding fruits to your carnivore diet, like Dr. Salandino does.
So basically, with carnivore is just removing all the carbs, essentially.
Yeah. And keto is, less than 20 grams of carbs. So they're very similar. But I would suggest if you do get, if you're a meat eater, go to a place that, like Brookhaven Farms. It's, they farm without any hormones, without any pesticides, and it's just an amazing place. Plus, it tastes 100% better. It's way better because you got to eat clean. When you have cancer, you have to be the cleanest of eaters.
Yep.
And I see it all the time. People that come to me with cancer, they love sugar because cancer loves sugar. They crave it. So in my mind, sugar is the number one bad boy for cancer patients.
But you're saying it's tougher for somebody with cancer to quit sugar because they crave it more?
Seems like it to me. The ones I've talked to, it's very hard.
Carnivore Craze, thank you so much for that, and thank you for the questions there. Real quick, I want to give a shout out to Sandra over in the UK. Thanks so much for being here tonight. We do this every single week. We hope to see you back. If you have a question, please put it in. We're here to help, and we love the UK. Thank you for being in here.
We love the UK. We love Australia.
We do. We got Debbie in here from Australia, Queensland. Let's go to real quick for Instagram. They've been patient with me. If I can find it, Afro Brain was asking about oxalates and their effect on the gallbladder. Can you touch on
Yeah,
that just
yeah,
a
it's a
second?
good point. Yeah, oxalates. I did a podcast on oxalates, and a lot of healthy foods are high in oxalates, and some people can't tolerate oxalates. They certainly could be a factor in the formation of not only kidney stones but gallstones. So, and some of those health foods like almonds and spinach, they're high in oxalates, and certain people cannot tolerate oxalates. So, look at my podcast on oxalates. It's a very interesting topic, and I think we listed some foods that were high
Yep.
in oxalates and foods that were low in oxalates. So, if you have kidney stones or gallbladder problems, and again, it can cause a host of other diseases as well. Look at getting on the low oxalate diet. Um,
Yeah,
Great question.
that's a great question, Afro Brain. And what we if you go on YouTube and search Tom Rogers performance medicine or just performance medicine oxalates, you'll find it. Actually, our nutrition coach Lucas Schmidt did one on oxalates as well, and goes over low oxalate diets. So thank you for that comment. I'm going to go back over here. I see let's see, where was I? Let's go back to YouTube. Foxy Moxie. I've been getting UTIs from my urologist checking my bladder every 3 months. Is this normal, or what can I do to prevent this? I'm still taking 222 milligrams of fenbendazole. I think there is okay. Has used Fenben for bladder cancer in June a year. Okay.
Good, good.
Okay.
I'd definitely be on Fenben. The other thing you should get on is methylene blue if you're not already taking it, because I think that prevents some UTIs. In some cases, it hasn't been a huge, major game changer for a lot of these women that get recurrent UTIs. It helps some. Personally, I think every woman in a nursing home should be on methylene blue, because it also helps dementia. It helps you utilize oxygen better. It's just a great supplement, all around supplement. We learned to use it during the COVID epidemic. It's been around forever. It's a precursor to hydroxychloroquine as a treatment for malaria years ago, and it still works as good as anything for malaria. But again, try to make sure you're drinking enough water. Sexual activity can cause chronic UTIs in some patients. Or some preventive measures you can take there. And you really need to be careful about sugar intake, because I think that leads to a lot of UTIs. Another good supplement that some people do to prevent them is D-mannose. I mean, sometimes it gets so bad if you're getting them chronically. Sometimes we have to put people on a nightly macrodantin antibiotic pill. A lot of times, if you have a chronic UTI, then you don't even know when you have one. You won't get that typical burning and frequency. So it can smolder along and boom, you're septic. So I agree with checking that pretty often. So it's a toughie. It's a toughie. I see that a lot. Get on methylene blue.
Yeah.
And
And Foxy Moxie, if you on our website, it's NeuroPro Plus. This is just the capsule form. There's also great stuff on Amazon that's pharmaceutical grade. I think it's actually called methylene blue, and I'm sure there's people in the comments who have used that. They can send out the link. So let us know if you have any questions about that, Foxy Moxie. Thank you so much for that question. All right, let's keep moving here. Such great questions tonight. Thank you, guys. Lisa always shares the broadcast. Thank you so much. Dr. Rogers, I now have MRSA in my abdominal surgical incisions that I had done at UT. Shoot. I have a PICC line and getting vancomycin. Is there anything I can eat or supplements I can take that will help knock this MRSA out of the park? Thank you. Well, Lisa, we're thinking about you. What's your thoughts on it?
MRSA's, common. It's a bad boy of staph infections. It stands for methicillin-resistant Staph aureus. And a lot of times you can see it post-surgical, and certainly the vancomycin is the treatment for it. The other thing, as far as your diet. Number one, stay away from sugar. I'm coming out against sugar a lot tonight, but stay away from sugar. Um, get on a good. I love the carnivore diet. I love the carnivore diet. I think it's a very healing diet. The other thing you might want to consider is using an antibiotic ointment in your nose, and maybe your belly button, and sometimes around the rectal area. It's called Bactroban, musopirocin. That should be in every medical kit. I got a refill of mine last week. I like to keep it around because it's a
Bactroban?
great Bactroban. And for people that get MRSA infections, a lot of times it's not coming from, the nurse or doctor that visited your room without sterile gloves. It came from your own nose a lot of times. So for people that get that, again, I know from, being around a lot of surgeons in my family, they pre-op their patient with Bactroban ointment inside the nose before surgery and after. So that's one thing you should get, Lisa, is some Bactroban. Start using it in your nose every night, the rest of your life, and maybe probably your belly button too. So yeah, interesting. You'll do well. You'll come through this, but boy, it's not a lot of fun.
Lisa, we're thinking about you. Thank you for being with us tonight and asking that question. Real quick, I saw on Instagram, it popped up on my feed. Denise, I love you. Thank you for being in here tonight. So good to see you. There's a COVID vaccine protocol, it seems. So we're getting a lot of questions around, if people are wanting to do some sort of detox for whatever reason. How are you kind of talking patients through that protocol? What does it entail?
Yeah, I look at Dr. McCullough's protocol. I gave 2 of them out today. And I'm sure they were vaccine injuries. There's no doubt in my mind. One of them was a resurgence of MS, that came on shortly after receiving the booster, and the other one was cancer. But yeah, God, we're seeing so much stuff. There's a protocol you can get. It includes, and it includes bromelain, I think serrapeptase, curcumin. I'm blanking out. CBD. Call the office and we'll print it up. We'll put the protocol up. There's a couple of them that we use. Zinc's one of the things we use, but it's more of they say a detox from the spike protein that may be beneficial.
Is there a resource you're sending people to? Does McCullough have it posted anywhere?
Dr. McCullough's spike protein detox.
Okay.
Yeah.
All right. I see Motaz is in here. Motaz, what's going on? Great to see you. Thank you for being with us tonight.
Hope you're doing well.
So good to see you. All right, let's get back to it. If you guys have a question for Doc, I'm going to try not to miss anybody. I think, there we go. Lee is asking, if you've been on antidepressants most of your life, is there a way to get off of them completely? Thank you, Lee, for this question.
Yeah.
What's your thoughts on this?
There is a way, very slowly. If you've been on them all your life, it may take a year to get off of them. Very slowly, because sometimes, even though they're not physically, you're not going to have DTs with it or anything, stopping abruptly, but you'll feel dizzy, miserable. So a very slow taper, very, very slow taper. And you might even want to start some of the more natural stuff, at the same time, especially if you have a lot of anxiety with it, but very slowly.
But you can get off of them completely if you've been on them for a long time.
Sure.
Okay. Lee, I hope that offers some encouragement there. Thank you for that question. Let's see here where we are at. Let's see if I can find. I saw one from Mark. There we go. A new recommendation for 90% fat and 10% or less protein for a ketogenic cancer diet. The same protocols as epilepsy. Most meats don't reach 60% fat and are over 10% protein. What can you do? So it seems to be, how can you actually execute on a 90% fat, 10% or less protein, I believe. Mark, let me know if I'm off
Well,
on
that's a
that.
toughie. I don't know how you're going to get that combination.
Yeah.
Yeah, I mean, a ketogenic diet's great for epilepsy. In some cases, it's the only treatment. But really interesting. Another treatment for epilepsy is CBD. Look at the story of Charlotte. That's how Charlotte's Web company came into existence. Treated a little girl's refractory epilepsy and cured her when nothing else worked. Nothing. But I don't know, Mark. That's going to be a toughie to get 90% fat, 10% or less protein. I'd have to look into that. I don't know if you could get that. I'm not sure about avocados. You know, again, when you get that kind of meat, I'll have to ask Jake about the percentage of the macros in his grass-fed beef. There's just a lot of protein in most good beef. That's one to work
10%.
on. I couldn't
Yeah.
tell you off the back of my hand how to do that, Mark.
That's a math macro problem there.
That is.
Because typically that your protein is going to go up if you're that low carb.
Yeah.
If anybody has any ideas, let us know. Any ideas around how to get that?
I guess you have to
that
drink
combo.
a lot of olive oil, coconut oil, and that type of thing. Eat a lot of avocados. You know, meat may not do it for you. You know, eggs. I don't know. That's a good question, Mark.
Mark, we're going to work on that one. Carter, I see you. Happy Tuesday to you. Thank you for being here
I love
tonight.
it when Mark asks an easy question. That's about once a year.
Mark, we about got our calculators out. My MyFitnessPal's app. I see here real quick.
Ask me one easy question like once a year. The rest of them are all hard.
Seems D-Lem met Jake last night. I love that. Jake is awesome. We love him. Shout out to Brookhaven Farms. Seems D-Len's close by. That's so cool. They do such a great job.
They deliver tomorrow. I've got my order in.
That's right. That's right.
Yeah.
Look at this from Roel Wagyu meat. That's interesting.
Wow.
Did you see in Kingsport there is a Wagyu hot dog stand just opened? A Wagyu,
what?
Yeah, a Wagyu.
It's Kingsport.
In Kingsport. It's called Wagyu Dog.
Where is that?
I don't know. I got an email about it, but it's downtown. Wagyu Dog. Has anybody been there? Anybody? Any Kingsport people? I see Riley. Riley, what's going on? I love it. I love it. If you guys have been to,
I'm gonna have to check that one out.
Check out Wagyu Dog. I don't think I have the email anymore, but it just got open or is about to open.
My favorite place is the Lobster Dog.
Yeah.
You know, they rarely come by, but they're all over East Tennessee, North Carolina area. Whew, it's good.
Thank you, Roel, for that. Let's see here if I'm missing a question. D-Len, Bactroban is prescription. Most doctors won't prescribe without patient needing it. How can we get it? This is a great question, and you know, when we get
become our patient. Whether it's telemedicine or whatever, I'll give you a prescription in a heartbeat. I firmly believe you should have your own medical kit with certain different antibiotics, Bactroban, ivermectin. There's certain things you should keep in there. Bactroban is certainly one of them. Surely a doctor will, you know, call you in a prescription if you have a family doctor. Just tell them that you have a cut or you have staph infection. You're worried about staph. Would you call in a Bactroban?
Yeah, you know, and I'm glad D-Len brings this up. I think we should have more conversations around, you know, how do I actually, you know, ask some of this stuff of my doctor who might not be, you know, exactly
as open to it.
As open.
Yeah.
You know, how do you go about these conversations? So I really appreciate that, D-Len. and we're definitely not asking you to lie.
Yeah, we are.
No.
We are. Sometimes you have to lie.
But like, I think this is a legit, something to bring up,
Yeah,
like,
your surgeon, I guarantee you, your surgeon will write you a script.
yeah.
It's just crazy if they won't. Maybe get off the black market.
Let's see here. So this is, we do have a pickup, I believe, in all the performance medicine locations in the Tri-Cities. Carter got her eggs and meat today from Brookhaven. I love it. Their eggs are worth it. They really are. They're the best over there.
And eggs are getting scarce, aren't they?
Yeah. We got some fresh eggs from somewhere recently, and Amanda could tell me if she's here. I forget where it was, but they were really good. They were fresh. Maybe from in Maryville somewhere.
Ben, speaking of Amanda, should we go ahead and make the announcement? We love Amanda. Amanda and Ben are getting married this weekend.
Yes.
So that's why Ben's haircut looks so good tonight. He's starting to look real sharp.
Thank you.
Like, and they're getting married this weekend. So everybody give them a well wish.
Yeah, well, thank you.
We love Amanda. It's wonderful. And we're so very happy for you, Ben.
Thank you.
And next week, speaking of that, you'll be on your honeymoon. So there won't be a Q&A next week. We're going to take a honeymoon from Q&A next week because Ben's the heart and soul of the show. So without you, it just doesn't work. Well, but everybody give Ben a well wish, for his marriage this weekend.
That's very sweet, Pop. I appreciate that. If you guys don't know, this is my dad. So, we like to have these types of moments on the show too. This is a big weekend for me and for Amanda and for our family. So thank you so much. And guys, that means if you have a question, let's get it in. Let's get it in tonight. We'll be back not next week, but the week after, and we'll be back for very rarely do we not do this on Tuesdays, and I honestly hate missing, but next week we're gonna have to.
You don't need to think about the performance medicine next week at all. You're always thinking about it, so next week you don't need to think about it.
Well, let's see here. Oh, thank you, Motaz. This is very sweet. I see Tom's question. I'm going to get to that just in a minute. If you have a question, go ahead and put them in the comments. We're going to be here for a few more minutes. I love this, Motaz. That's so sweet. Thank you.
And Motaz, we do telemedicine, with Motaz since he moved, and just a wonderful, wonderful man with a great family, and he's smarter than any of us put together. The guy's incredible, PhD, and he could rule the world.
We love you, Motaz. Thank you so much. And D-Lynn is, I'm with you. A little white lie never hurt anybody.
I'm with you, D-Lynn. Look what Fauci did to us. He lied the whole time. Why can't we lie a little bit? We're too honest. I believe every patient should have a medical kit, and the right to request it. I mean, people are smart. They know when they need an antibiotic. Usually, if they're traveling, they don't want to go into an emergency room for something they could have taken care of right there. If you have to call the doctor, hey, I have this Z-Pack with me. Here's my symptoms. Should I take it? Of course. Use some common sense.
Common sense. Let's bring it back this year, guys. Thank you, guys. Y'all are so sweet. This is true. I am. Yes, that is true. Thank you, guys. Thank you so much. All right. Let's see if there's no more questions. We're gonna sign off here in just a minute. Have you had the rib roast yet from Brookhaven? I see Tom's a rib roast fan from Brookhaven.
We did have it. It's fantastic.
That's awesome. That's awesome.
We did get it. Their burgers are unbelievable. I mean, just their burgers. Their burgers taste like a steak, as good as a steak, I think.
I see. You know what? Brookhaven's in here. Brookhaven, what's going on? I see Josh Davis is in here. We got to get him on the podcast. I got to text him back.
We talked about him today. One of my patients is training with him right now, and you just brought her to a new level.
You hear that, TriStar? Bringing patients to a new level. I dig that. I dig it. Josh, I love you, man.
Josh is like me. He doesn't believe in normal.
No.
He believes in optimal.
No, absolutely. That's exactly right. I hope Adonis is with you, brother. right now watching the show. I love it. That's right. That's right. TriStar, we got to get in the workout.
He's
Okay.
probably working out right now. Josh is probably working out right
He's
now.
probably on the assault bike right now as he's listening.
He's in zone 2 in the assault bike. He doesn't even have to move to, zone 1 or
I tell
zone
you what,
3. I mean, he's in zone 2 on the assault bike.
if I just sit down on an assault bike, I'm in like the highest zone there is.
Yeah, you're probably in zone 5 by the time you get off that or the rower. You like the rower, you know. One thing I will say, Ben, while I'm got you, it's just great to be back at work. I really missed work, believe it
Yeah.
or not. I had a great time in Florida. I love it down there in the winter, you know. But I missed work because I really like the I see so many interesting cases that are just, and I like to tell these patient stories that I do a lot because it's just amazing, how dysfunctional our medical system is. It's just almost laughable sometimes how it's gotten, how inefficient, greedy, non-empathetic it's gotten. It
Yeah.
really is. Here we have all this great technology, yet, doctor won't spend more than 5 minutes with you to get to the root cause of the problem, which a lot of times will just involve asking a few questions,
Well,
just
one of my favorite stories is I think there was a patient who went to a gastroenterologist,
enterologist.
and they never asked them what they ate or something.
Oh yeah, that's common.
It's just wild to me.
I don't know why. I love the GI friends, the guys, but they just scope all the time. Some of them are really good. There's a few that will dig into it, but a lot of times, they diagnose you with ulcerative colitis, and they never ask you what you eat. Like it doesn't make a difference. Here's your medicine for it. That's what you have to take the rest of your life. Not, I wonder if we could get to the root cause of this. There's something that precipitated this. I had a real interesting case last week. It was kind of a curbside consult. The young man had been suffering from almost a disabling, healthy guy, restless leg syndrome. And that can be painful. It can be serious. It can really be debilitating. RLS. Have I done a podcast on that?
No.
I need to do a podcast on that. Put that on my list if you don't mind.
Do more people have that than I might think?
It's more common than you might think. I think maybe 10%. It's up to 10%. I have one patient who has to take methadone because it's so bad in him. But anyway, this is a pretty good story. It's just along the lines of what we're talking about. So this was just a curbside friend consult kind of thing, friend of a friend. But anyway, he had been suffering terribly for 3 months. So he finally went to the doctor, who did some routine blood work, which was normal, and said, yeah, you have restless leg syndrome. And, he'd tried some magnesium or something, but nothing really worked. So the doctor, first visit, prescribed him Mirapex, which is a medicine for restless leg syndrome. And so this patient gets home and starts looking at the side effects from it. And, they can be pretty intense. This is something, just you have to take the rest of your life, I guess, because you don't know what caused it. Which sometimes we don't know what causes it. So he kind of just asked me, if I had any ideas, should he take this medicine? So I just start talking to him. And I said, how long? You say this has been going on for 3 months. Yeah. Did anything happen? What happened 3 months ago to precipitate this? He goes, I don't know. And I go, well, did you have a virus? Did you have the flu? Did you have COVID? Did you have a recent vaccine? No. Did you start a new medication, supplement? Did you undergo a period of extreme stress, which can precipitate anything? No. They go, tell me what you eat. What's your diet like? This was an in shape guy. He goes, well, yeah, 3 months ago, I started a vegan diet.
That is a big change.
I go, my eyes got about this big. I go, you're telling me that you started a vegan diet 3 months ago. I go, you think that might correlate with 3 months worth of restless leg syndrome?
That is
And
so
I said, did they
interesting.
check your iron level? Because iron deficiency is a major cause of restless leg syndrome. He said, no, they didn't check that. I go, well, tell me what your hemoglobin was. And he got his labs and looked, and it was 13, which is on the low end. It's not, it's within normal limits, but it's on the low end, especially for a man. And I go, you've got an iron problem. You went vegan, you're not getting any iron in your diet. Start taking some iron, preferably go get an iron, a ferritin level, but start taking some iron or go eat yourself a big juicy steak and see what happens. Can't wait to see how he did. But I can almost guarantee you, he gets off that vegan diet, he's going to be better, or at least gets on an iron if for some reason he wants to continue the vegan diet. But when you get on a vegan diet, there's a lot of things you need to supplement with.
Right.
And, you know, I almost guarantee it was low iron. Can't wait to talk to him again when he, you know, follows up with me.
Well,
Isn't that
and
amazing? Because really, that's what's wrong with medicine. You need to take the time to dig into these things as to what might have caused this. Um, you know, so
and
do a
that's
little digging, ask some questions, especially about dietary habits.
and that's another thing I think everybody in here can kind of take away is, you know, if keep track of like anything that you did change, whether you started something, stopped something. That's something that we all have control over. And that at least gives you something to talk about with your healthcare provider. But man, they could have ended up on that medication for a long time.
For life, yeah. I mean,
Real quick, I see here from Loretta. Thank you, Loretta, for commenting here. I'm now on Mirapex twice a day for the last year and still will have daytime restless episodes.
look at your iron levels, Loretta, your ferritin levels, and make sure that's ruled out.
Yeah.
You know, that's not every time, but that's certainly a major cause of it I found through the years. So,
and real quick, while I have everybody, if you guys have any podcast suggestions, if there's anything you want us to dive a bit deeper on and do a common sense episode or an explain this episode, let me know in the comments. Restless leg syndrome is on the list now. Let's get this for Roel. I love this question. Does nail rapid growth a good indicator of health? That's interesting.
It is. It is. And it's also an indication you're probably taking some supplements that are good for skin and nails. I would assume. Yeah, when I take my supplements, especially that Happy Healthy Hair, which I take, you know, my nails grow faster, stronger too.
I love this. We had the staff singing on Monday. You were back. I love that. Doc's first full week is this week. So we had everybody was excited. Orphan was excited.
Orphan gave me a big hug. Yeah. You know, he got in major depression when I left. It's either that or bipolar. I need to look into that a little further.
We love you guys. All right. I think we got to all the questions. If there is a question, let me know in the comments. I see more. Okay, Maureen, thank you. Tom, I see you. Let's get this here. Any thoughts on DMSO oil? Yeah, thank you, Maureen, for this.
Yeah. That's another one I need to do a podcast on because, I like DMSO. Dimethyl sulfoxide, I think, is a long chemical term for it. But man, DMSO is awesome. It's really used as a vehicle to get other things inside through the skin. And I think that's where it's the most useful. Although sometimes by itself, I've used it, experimented with it a little bit. So it's a great healer. You know, I've made my own into sprays at times, diluting 99% DMSO with half sterile water and sprayed it on different injuries. Sometimes I'll use it to get, like a hydrocortisone gel or ointment in faster, or like a ketoprofen anti-inflammatory for a joint. But I really like DMSO. It's old as the hills, and it's very underutilized. The FDA doesn't like it for some reason, but it's pretty safe unless you do something really nutty with it. But yeah, I do like it, and put that on the list too, Ben. DMSO. Matter of fact, while I was in Florida, I read a whole book about DMSO.
What book did you read?
Oh gosh, I'll have to get you the name of that because I may have loaned it out when I got back here. But it's not an MD that wrote it. It's a guy that really does a lot of alternative type treatments. He's done some research on some cancer protocols as well as red light therapy, that type of thing. But he wrote a book on DMSO. And if you follow like the Midwestern Doctor, he talks about it a lot. But yeah, it's a really interesting compound that they should be using it more often.
But what would you use it for?
Just like I said, to get stuff into the skin, for joint problems and for transcutaneous. Some people take it orally though, for other reasons. But I'll do a podcast on that one. Put that on my list too, Ben.
I got that, Maureen. Thank you, Maureen, for that right there. And thank you. Okay, I see. Sorry, Foxy Moxie. Did we answer your question, Foxy Moxie? Microplastics. I love this idea as well.
Yeah, I've kind of started getting together some information about that. Atia talked about it a couple weeks ago.
What question did we miss, Foxy Moxie? I'll get you real quick. Let's get to my brother Dave here. Dave, what's up, man? What brand of red light therapy machines might you recommend and why? I believe we talked about this a few weeks ago. You like Sunlight?
I researched them a little bit, and the one I ended up getting, if Katie's on here, she knows the brand because I had her order it for me.
Is it Sunlight?
No, that's my infrared sauna.
That's infrared.
This is a bank of red lights. Gosh, I love it too, Dave. Besides, that Gretsch White Falcon sitting back there, that's my favorite thing. Or maybe my Les Paul. Or my 50th anniversary Jimmy Page Telecaster. Or my first guitar, which is the red Strat. Everybody has to have a red Strat.
You're pointing perfectly to these guitars like this. Have you been practicing that?
No, I just see it behind me. I see it. I can see it behind me.
I want to put this up from Foxy here. How much milligrams of the methylene blue? How do you kind of advise or talk about this?
Usually I start out with, it's very well tolerated. If you happen to be on an SSRI, you got to be cautious with it. But the doses we use, I've never seen anything like serotonin syndrome. But start out, like if you do the liquid 8 drops a day for a week or two, then go to 16, then you can go up to 32 very safely. Or if you decide to take the pills, the ones that you showed, start out at a half of one. That's 8 milligrams. That also has NAD plus and
C.
C, I think.
It has 150 milligrams of vitamin C in it. It has methylene blue 30 milligrams. I guess that's in 2 though. So 15.
Yeah, take one has 16. So I start out with half one, which is 8, and then go to whole one. You tolerate it, be fine.
Yeah.
But that's what I would do. Start out at 8 drops or half a tablet, go up into 16, on up to 32, 1 whole tablet, go to 2 if you need. I think Andy takes 2. Methylene blue is great. You turn your urine blue.
I heard about this, Roel. I heard Joe Rogan talk about this with the Girl Scout cookies, and it is devastating.
Oh, it's awful.
Because I'm such a fan.
It is awful. They taste good, but man, stay away from them. I had a Girl Scout come to my door and my dogs were just going crazy. So I told her it was a bad time to come back. Half the reason I did is because I would like to give her as a donation, but I didn't want any cookies around the house. Those things are addictive and terrible.
Foxy Moxie, it is, if you look up NeuroPro, Neuro Pro, you can find on our website if you want to look there, performancemedicine.net/shop. It's on there, but if you just search for NeuroPro Plus, if I can see. There we go.
Yeah.
Guys, how'd we do? How was the show tonight? Pop, you did awesome tonight, man. Thank you for this. Mark wants to know if the dogs went on vacation. I know the answer is no.
They stayed here. They stayed here. I missed them. I don't know where they are tonight. They're not,
Tom, thank you, brother. I'll check that. Thank you so much. We got a prime rib recipe. Also, if you guys have any more, anything you want to dive deeper on, let us know. We will go through all the comments. Thank you, Cherry. Let us know how we did, guys. I thought we're not even rusty. Like that was as smooth as ever.
That went smooth. And sometimes you just need to recharge your batteries. I'm pumped up for the wedding. I can't wait. I'm in a good mood.
Thank you, D-Lib. Yeah. Thank you so much. All right, Pop, we're going to call it an evening. We're calling it a show. Guys, thank you so much for tuning in to the Performance Medicine Show, our live Q&A. We do this every single Tuesday, 7 to 8 p.m. Next week, we're going to be off, as you know, but we will be back the following week, which I believe would be March 9th. Okay, I see you, Foxy Moxie. Nato can yep. I got you. All right, Pop, thank you so much. Kim, thank you.
Good job.
All right.
This weekend.
Brad, where's my outro, Brad? Come on. There we go.
Don't go away.